Everyone for joining us on a lovely fall day. I'm Brad Schneider. I represent the 10th District of Illinois, and for today, something I'm very proud of, I have the privilege of chairing the New Democrat Coalition for the 119th Congress. We're here today. As we stand here today, New Dems represent the largest ideological caucus in Congress with 115 members. We were 116, but Governor-elect Mikey Sherrill has stepped away, so we're looking forward to filling that seat. New Dems represent the middle majority of Americans. These are the folks who are tired of the gridlock, tired of the extremism in Congress that prevents us from addressing the important issues they're facing every day in their lives as they're trying to just go from day to day. As we all know, health care is top of mind for these individuals. And for our constituents, we know that, and as their representatives, that's what we're working on. Hardworking Americans are preparing to pay, on average, 114% increase in health premiums. Think about this. They are seeing their premiums double and even triple. Many Americans are going to lose their coverage altogether, all because of the backwards and extreme efforts of this Trump administration and congressional Republicans. That's why I'm so happy to be joined on stage today by some of the brightest minds in our coalition to announce the release of the New Dem Health Care Action Plan. These lawmakers have worked tirelessly to craft a common sense, pragmatic, and forward-looking agenda that will guide the New Dems' work to lower costs, expand access, and improve quality of care for every American and their family. I want to thank the Healthcare Working Group Chair, Congresswoman Terry Sewell, as well as our task force chairs, Dr. Kelly Morrison, Chantel Brown, Julie Johnson, and Madeline Dean, for their vision and their leadership. I also want to recognize the 5 New Dem doctors who are essential to our efforts on this issue. Alongside Dr. Morrison, we have Dr. Ami Berra, Dr. Raul Ruiz of California, Dr. Kim Schreier of Washington, and Dr. Herb Conaway from New Jersey. Amidst all this chaos and uncertainty, the American people are looking to Congress for a path forward to address the ongoing healthcare crisis. That's exactly why the New Dems are releasing our Healthcare Action Plan. Now I'd like to turn it over to our Policy Vice Chair, Nikki Budzinski. Thank you.
Thank you, Brad, and thank you all for being here today. As Vice Chair of Policy, my mission has been to craft a practical, common sense New Dems agenda that speaks directly to the challenges keeping families up at night. Right now, those challenges are all about cost. It's wondering how you're going to afford the electric bill as temperatures drop. It's worrying whether your child will have access to a strong public education. And it's questioning if you'll be able to get affordable, high-quality health care when you need it. In the richest country in the world, these shouldn't be privileges for a select few. They should be accessible and affordable for every person across the country. Now, those sleepless nights worrying about these issues are even more strained as millions of Americans are facing doubling or even tripling healthcare costs. Healthcare is at the center of the cost of living crisis, but the truth is the affordability and accessibility of care has been an issue long before Speaker Johnson and President Trump got their hands on it. It is imperative that we reverse Republican cuts to Medicaid and the ACA. But we also can't just go back to the status quo. We need an agenda that offers a new vision and one that inspires. That's where the New Dems Healthcare Action Plan comes in. Our framework offers a new path, a better one that lives up to our core belief that every American deserves access to quality, affordable health care from providers they trust when and where they need it. It's a comprehensive strategy to address everything from insurance premiums and prescription drug pricing to vaccine misinformation and reproductive freedom. It also focuses on accessibility by strengthening Medicaid and Medicare and closing coverage gaps in rural and underserved communities. As New Dem's Vice Chair for Policy, I'm excited to work to advance this agenda in Congress, and I hope that our colleagues across the aisle will join us in these efforts to make health care stronger and fairer for the American people. And with that, I will turn it over to our wonderful New Dem Healthcare Working Group Chair, Terry Sewell, to talk more about the details of this plan. Terry, thanks.
Good morning. I'm Congresswoman Terry Sewell. I proudly represent Alabama's 7th Congressional District. I want to begin by thanking our chairman, Brad Schneider, for his incredible leadership and all of the members of the Healthcare Working Group for their hard work on this action plan. As chair of the Healthcare Working Group, I stand here today with my colleagues to unveil a plan that puts the health and well-being of the American people first. Right now, families across this country are facing uncertainty and rising costs because of a reckless attempt to dismantle the programs that millions rely on. In Alabama's 7th Congressional District, we are seeing the consequences of the Republican health care crisis play out in real time. Premiums are skyrocketing. Rural hospitals are on life support, and thousands are being kicked off of their health care insurance. Today, we, the New Democratic Coalition, say enough is enough. This action plan is simple and straightforward, but it will go a long way in ensuring that our health care system works for every American, not just the privileged few. Our plan is guided by 3 core principles. First, we believe that every American should have access to quality, affordable health care with predictable costs, because no one should have to choose between paying for a prescription and putting food on the table. Second, we believe in strengthening Medicare, Medicaid, and the ACA, because these programs are not partisan luxuries, they are lifelines for so many Americans. Third, we believe that every American, regardless of their zip code, should have the access to doctors, hospitals, and medicines close to their homes. To achieve that, our plan takes a series of common sense steps. It would lower costs by locking in the ACA's enhanced premium tax credits and extending out-of-pocket drug caps to Americans with private insurance. It would reverse the devastating cuts to Medicare and Medicaid while cracking down on fraud and abuse. It would close the coverage gap that continues to plague states like Alabama by restoring the Trump administration's $90 million cut to the ACA Navigator program and streamline enrollment. It would also protect women's health care, encourage research and innovation, and strengthen our public health infrastructure. At its core, this action plan is about restoring integrity and security. It is about ensuring that seniors can retire with a peace of mind, that parents can take their children to the doctor without fear of bankruptcy, and that every American, regardless of income or zip code, has access to quality, affordable health care. Health care is not a privilege in this great country of privilege. It is a right, I believe. We are committed to defending that right against those who would undermine it. So today we call on our colleagues across the aisle to join us. Let us put politics aside and put the needs of the American people first. Let's build a healthcare system that reflects the values of fairness, compassion, and responsibility. The New Democratic Coalition is proud to lead this fight. Together, we must ensure that our healthcare system works for everyone, not just the wealthy and well-connected, but for every family in every community, and we are resolved to making that happen. With that, I will hand it back over to our chair.
Thank you, Terry. Thank you, Nikki. I want to thank the entire working group again, and we're happy to take any questions. Please.
One of the biggest criticisms we've heard from Republicans over the last couple of weeks is that how can it be the ACA, how can it be Affordable Care Act if it needs to be subsidized? I'm looking for a rebuttal to that because if you're looking for the extensions, what's the plan to have it be affordable?
Yeah, I'll turn it over to Nikki in a second. One thing I'll say is what the tax credits say is that no one should pay more than 8.5% of their income in healthcare premiums for their insurance. They still have the out-of-pockets and the deductibles, but it's 8.5%. And the government subsidizes insurance, whether you work for a company and get your insurance through your employer. The employer may pay a part or even a bulk of that, and they take a deduction. They get support and a subsidy from the government. If you get your insurance through Medicaid or Medicare, you're getting government-supported insurance. We're making sure that everyone in this country has access to quality, affordable care. That's what this is about, and what the Republicans are doing, and we're seeing it with the premium notices that Americans are getting. They're increasing the cost of insurance for hardworking families, and they're making it impossible for many of those families to provide for themselves or for their kids the insurance they need to stay healthy and secure their future. So let me turn it over to Nikki to expand.
The only thing I would maybe add to that is in the healthcare plan that we have is some provisions specifically around transparency. No surprise billing, for example, for the healthcare for hospital systems. We also tackle some of the issues related to medical debt, which we know also helps to contribute to making the ACA more challenging to afford if you're balancing medical debt. One of the things that we put in our provision is in our plan is that medical debt is something that a credit agency cannot be reported to a credit agency. So we're looking at holistically how we're able to strengthen the ACA, and I think we can do that through more transparency, which we hope will shed some light on where we can bring down costs to make premiums more affordable. Yeah.
Yep.
Thank you all for doing this. I'm curious if you can kind of drill down and talk about how the plan kind of addresses, diverse communities. If you look at kind of where the healthcare crisis is really acute, it's communities of color, it's women, LGBTQ communities. As you look at making sure that healthcare is affordable for everyone, can you speak a little bit about how acute this crisis is for a lot of the diverse communities who are out there, who are covered by a lot of the, tax credits and a lot of the plans that are in this agenda? And also, can you speak about the impact of, losing these healthcare, this healthcare support for small businesses? That's something that, I know that's important to New Dems, supporting small businesses. So can you speak about healthcare as it pertains to diverse communities and small businesses?
Yeah, I think I'm going to have everyone touch on that because I think each of us have a point. I'll talk about the small business real briefly, having been a small business owner. What I can tell you is that nearly half, almost 50% of the people who are getting their health insurance from the Affordable Care Act exchanges either own a small business, work in a small business, or self-employed. The companies in our communities, those small businesses that you'll see their names of their companies on the back of the Little League shirts, the folks who are supporting the local theater, those small businesses depend on the Affordable Care Act and those subsidies to provide insurance for themselves and their employees. And so that is the key thing. Let me turn over to Terry, and we'll just go down the line because I think everyone has something to say on this.
Well, let me just say that I represent a district that has both rural and urban underserved communities. And I believe that this action plan is exactly what they need in order to be able to afford quality health care. I also think that it is very important that we try to save our rural hospitals. I think everyone up here has rural hospitals in their district. And those of us who are in states that did not expand Medicaid, like Alabama, those rural hospitals are on life support. And so we believe by making sure that we have ACA navigators that can help on the front end to enroll vulnerable communities, as well as making sure that we're securing our rural hospitals by supporting access to those hospitals, as well as making sure that we have timely reimbursability, which I think has been a major problem for so many of our constituents. In fact, I dare to say that I write more letters to CMS than any other agency in the federal government over my time here in Washington. So trying to make CMS more efficient will also be a lifesaver. And in terms of small businesses, I think Brad is absolutely right. I can tell you that in my district, recently at a town hall meeting, one of the gentlemen who works for a small business, has only 6 employees, he has been affording his health care insurance through the ACA for the last 5 years. And his plan, which is a silver plan, was $188 with the enhanced tax credits. He received a letter from Blue Cross Blue Shield that said that his plan, the same plan that he has now and pays $188, will go up as much as $1,500. This is not something he told me. He shared the letter with me. And it's unacceptable. This man doesn't, he's 60 plus years old. He and his wife are both in their 60s. They rely on the Affordable Care Act for their health insurance, and they simply cannot make ends meet and pay for health insurance when it goes up that dramatically.
Terry, just to be clear, it's $1,500 a month.
$1,500 a month. Yes, that's exactly right. And so it is really unacceptable what our Republican colleagues, it's been a Republican healthcare crisis that they created, because we know that by expanding or extending the Affordable Care Act tax credits by December 31st, so we would ensure that these dramatic increases would not occur. Please know that both small businesses and minority communities are top of mind when we in the new Democratic coalition drafted this plan.
Could I add something
Yep,
to
and then
that? I just want to
wanna go
highlight
to
something
Julie,
else.
or-
Oh, yes, of course, of course. I just want to draw attention to, when we're talking about underserved communities, the restoration of the cuts to research in particular, and how important that is to serving the unique needs of our underserved communities. What this administration has done to basically gut NIH is devastating when we're trying to better understand the unique impacts and the unique healthcare needs of our underserved communities. So you'll see that is also in Terry's plan, the healthcare plan, to restore that funding. Yeah.
I'm Julie Johnson from Dallas, Texas, 32nd. Texas leads the nation in people without access to health care. We are a minority state. 60% of our population are people of color. And we have over 6 million people without access to health insurance currently. And with the ACA cuts that are going to happen, we're going to add another million. And when the Medicaid cuts happen, we're going to add another couple million. And so our healthcare crisis affects all people of color. It affects all LGBT. It affects so many people in our state. And I think if you look at also to your question, unfortunately, we have huge economic gaps of working people of color from working white people. That is a system that we have to address in this country as well. That why so many more people of color are on Medicaid and are need these tax credits. It's another conversation that we need to address, but this plan is critically important to making sure that we have a safety net for everyone. In Texas, we have had 27 rural hospitals close in just the last 10 or 15 years, and we are facing many, many more. Our healthcare crisis is acute in the state of Texas because Republicans have consistently failed to prioritize the healthcare people. Now, you have to remember, this isn't a money issue for the state. We're sitting on almost a $70 billion surplus fund. We can spend the money to have healthcare in Texas if our elected leaders chose to make that a priority. But instead, they have consistently chosen not to make that a priority at the state level. So it's mandatory that us at the federal level come in and make sure that these programs remain intact. Millions and millions of Texans rely on Medicaid. And due to the low income gaps, that the ACA is critically important. And we need these subsidies because people can't afford it. And the alternative is we just have millions more people without access to care that then use our emergency rooms as a revolving primary care facility and have mounting debt. And then we have more unfunded care that the system cannot sustain. Just an example is my wife is a gastroenterologist, and she would do hospital call. And I remember very clearly, there was a weekend when she was on hospital call in the Dallas-Fort Worth Metroplex at a large hospital where she had 62 consults in a weekend. Only 2 had insurance. That is not sustainable for our provider networks. That's not sustainable for our healthcare providers to be able to do that. And so what the federal government is doing, what Republicans are doing, is they are basically saying we're refusing to accept responsibility for the health care of Americans, and instead we're going to make physicians and hospitals own that out of their moral obligation to take care of people. at great financial peril. And what we're seeing is hospitals closing, community health clinics closing, medical practices closing because they cannot sustain the influx of unfunded care that we have in this country. And so why the New Dems plan is so critically important is we keep the safety, we keep together. It's not perfect. There's so much more work that we can do, but the safety net is there to keep our healthcare system from completely falling apart. And so I think it's critically important. I think what this plan does is keep all of those things in place for all the communities. So,
Great, thank you. Dr. Morrison.
Two quick thoughts. Thanks for your questions, both very important ones. Kelly Morrison, Minnesota's 3rd District. I'm also an OBGYN. I sit on the Small Business Committee. So first to your question about small businesses. The trauma that this administration and its Republican majorities in Congress are layering on to the American people are astonishing. Small businesses rely big time on the ACA to stay intact. The tariff wars that this administration is imposing on those small businesses, in addition to now removing their health care, makes it unviable for them to continue to stay in business and in many cases to take care of themselves and their employees. So small businesses. As an OBGYN, it is horrifying to me that the United States of America was already an outlier in maternal health outcomes before this Trump administration. We know that Black and Native American women die for a pregnancy-related cause at 3 to 4 times the rate of their white counterparts. Absolutely unacceptable and shameful. Ripping away health care, ripping away Medicaid, dismantling the Affordable Care Act will only make those numbers worse. We have a maternal health crisis already. These cuts are making it worse already. It's devastating, and we have to take action now to turn it around. The American people deserve so much better. And as Representative Budzinski said, we are the richest country in the world. We need to take care of our people.
Thank you. Please.
I have 2 quick questions for you. First, I want to touch on the preserve and stabilize the enhanced premium tax credits. Obviously, time is running out here on that. What are the New Dems doing in terms of trying to get some moderate Republicans to sign on to this discharge petition to force a vote? Or are you guys considering endorsing the Fix-It Act that Sam Liccardo and Kevin Kiley have introduced? And second, I just wanted to ask, obviously these are policy priorities that reflect a lot of Democrats across the board, wherever they sit in the spectrum of politics. Is this kind of the framework that Democrats are using leaning into 2026 and the campaign, since you guys are in the minority and a lot of this can't be accomplished without Republican support?
So I'll touch on both briefly. We've been reaching out and will continue to reach out to our Republican colleagues across the aisle, always willing to sit down and talk about any issue. Right now, of paramount importance is healthcare. We were talking about this over the summer. This was not a surprise that these tax credits were expiring at the end of this year, and we'll continue to reach out and have those conversations. So we're going to look at any and every possible pathway that will get us to where we need to be, which is getting something that can address the challenge Americans are facing. I think the average American doesn't care what flavor the legislation is, as long as it takes care of the challenges they have, which is not just trying to make ends meet. And we just had the Thanksgiving holiday, and affordability is an issue everyone's facing. Affordability means as you approach the end of the month, you aren't looking at your checking account with a big fat zero saying, how do I pay my bills? It means that you're paying your bills, you're providing for your families, and you're actually having a little bit left at the end of each month to secure your future. And I think that's what New Dems have been about, are about, what we're focused on. As far as looking forward, this is what we see as the way to address the challenges that the American people are facing. And this is one of many policy frameworks that we've released. We've got healthcare, we've talked about tax reform, we've talked about housing. There's a long list, because what New Dems have always been about is trying to understand how do we help American people achieve their goals, clear obstacles, and create pathways for them to find their success and make our country stronger, more secure, with a growing economy, healthy and safe neighborhoods, and a strong national security, national defense. That's our platform. So.
Can I ask a quick follow-up? What do you make of the president saying yesterday
So a president who's a billionaire, who is reaping billions of profits, that what we're seeing from everything he's doing, there's a stench of corruption, and it permeates everything that is happening, and he's putting money into his own pocket. He's not looking at his checking account day to day, especially at the end of the month. We understand that the American people are really struggling, whether it's groceries, the cost of housing, cost of energy. All of these things have gone up over the past year. And it's not a new principle that it's always about the economy. If the economy is strong, if people are feeling good about their future, if they know that their current moment, they can pay their bills and they can secure and have a confidence in their retirement and know that their kids are going to have a better future than what they have today, the same way our parents sacrificed for us, then all of our other challenges shrink and we can tackle them and take them on. When people are insecure and feeling that they aren't getting that chance to make ends meet and get ahead, every other challenge seems greater. So this administration came in promising a year ago, then President-elect Trump was talking about affordability. A month ago, he was saying it was the #1 issue they need to focus on. And when the realization comes that what he's been doing, his policies are making life more expensive, not less expensive, less affordable, he says, okay, we won't talk about it anymore. Well, whether he talks about it or not, whether the data is released by the administration or not, the fact of the matter, working families in this country know that life is getting more expensive, and Democrats and New Dems understand that we have to address the challenges they face and make their life easier. Anyone wants to add? So, all right.
Just to follow up on that issue, with this framework, are you saying it's something comprehensive or nothing, or would you be open to something like what Congressman Fitzpatrick is doing, which is, 2-year extension, but then a pathway to something like HSAs? Is that sort of approach off the table de facto?
I think, and this may be what has always distinguished New Dems in general, is we're moderates. Moderates, I have always said moderates is a style, it's not a position. It's a way to get things done. We don't take things off the table. We want to put ideas onto the table, and we'll work with anyone who comes to that table with fresh ideas, an open mind, and a willingness to work together to tackle the challenges the people we represent are dealing with. And so we're not going to take anything off the table. We're going to have those conversations. We understand that we need to make health care affordable for all Americans. We know that Americans today are paying, or are going to pay next year, double, triple what they're paying currently. Terry told the story about someone whose insurance, what was their monthly?
It went from $188 to $1,500.
All right, so from $188, which is roughly going to be $2,300 a year, to $1,500, $18,000 a year, that's unaffordable. And families are seeing that across the nation. In my district, I've heard similar stories. You're hearing it everywhere. So we're going to work with anyone and everyone willing to address the challenges, come up with ideas, and move the country forward. So, all right. Well, thank you guys very much. I want to thank my colleagues. Great work. Have a great day.